Hello everyone. I'll be demonstrating a septum resection by a 2.9 mm hysteroscope with cold scissors and use of bipolar electrodes. When you insert a hysteroscope vaginoscopically, visualize the cervix, check the cervix and then proceed inside. Here we can see that the endocervical glands are slightly enlarged. Let the fluid pressure dilate the path for you and then go ahead. Once we advance the scope, we see a small calcific lesion noted at 3 o'clock position. So as of now, we won't be doing anything and advance the scope till the level of internal os. Now we can see the internal os, which appears to be a horizontal elliptical opening. Adjust the scope so that you do not touch or scrape the endometrium. Now that we are inside the cavity, we can see a broad-based septum. Here we can see the right ostia, which appears to be normal without any congestion or micropolyps. On the left side again we see the left ostia. Some amount of congestion is noted with a small endometrial membrane covering the ostia. Once we have visualized both the ostia, also check the posterior wall. Here we can see some dilated congested blood vessels. On the right side there seems to be a normal endometrium, but the endometrium appears to be slightly thin as compared to what we might expect. Now introduce your scissors, check both the ostias and use them as your guide and start cutting in the center. Make sure that the distension pressure is enough or adequate so that once you put a cut, there is a splay of the tissue. Here you can see that I have kept the scope slightly away from the scissor so that I can visualize the ostia very well. Start slowly and check for any dilated blood vessels because such a broad septum may generally have a good vascular supply. Check the ostia again. Now you can still see some adhesion tissue or septal tissue. So proceed cutting with the scissor slowly, steadily, step by step. As you can see, because of some amount of blood loss from the opened vessel, the vision is being compromised slightly. In such situation, you can increase the dilatation pressure by around 10 to 15 mm of mercury if you have a hysteromat and continue with the resection. Make sure that you are always in the same plane so that you get and achieve a good septal resection. Now that I have done enough resection, I recheck the ostia if they are aligned at the same level. Still some amount of arc is noted. So I proceed ahead, insert my scissors again and resume the resection. As you can see, there is a small dilated blood vessel which has opened up because of the resection. My vision is slightly compromised but not to a point where I cannot see anything. So I continue with my resection, slightly taking the scope closer to the point of resection and continue with my cutting slowly, steadily, snip by snip. Now again you can see that a small blood vessel has opened up and my vision was slightly compromised. Now that I have done enough resection, I see that my vision is slightly compromised, so I look at both the ostia for the guide. And since there is a small amount of arcs still left, I decide to continue with the resection. To cut the arc in the middle, I proceed ahead and go step by step again. It is very imperative that you take small snips. If you take a large chunk, there is a danger of opening a large blood vessel which will cause a lot of bleeding and compromise your vision. So continuing with the resection with cold scissors, I noticed that I opened up a small blood vessel which caused a bleeder and which compromised my vision to a certain limit that I could not continue the resection. So I again checked both the ostia which act as a guide. As you can see, there is a pulsating vessel at 5 o'clock position which is causing a lot of bleeding and hence obscuring my vision to have a clear vision to cut the septum. As you can see here, the vision is slightly compromised. So what to do next? In such cases, increase the fluid pressure slightly and try to wash out the blood. I introduced a bipolar electrode in order to buzz the pulsating blood vessel which is bleeding and causing the problem with the vision. So here is the 2 mm bipolar electrode. I visualize the blood vessel which is pulsating and then I just give a small buzz. Just by coagulating this small segment of the vessel, the vision has cleared out significantly and giving me a very good picture. So I'm again checking for any other pulsating blood vessel. There you can see. So here another small buzz and the bleeding immediately stops. The advantage of this bipolar electrode is that it works through the same instrument channel as your scissor. So you don't need to use a resectoscope or have an assembly or expensive instruments to cause coagulation for such a small blood vessel. So a bipolar electrode is a very handy tool and will help you in such situations where there is a small bleeder which may inhibit or cause problems with completion of the process. With bleeding and poor vision out of the way, I can continue with the resection of the septum at the center and complete the entire procedure without any problems. With the last few cuts, I then again look at my guide, the ostia, the left one, the right one, and both of them seem well. The panoramic picture shows me a good enlarged volume of the cavity. This whitish area was the area of the septum, and as you can see that the fundus has increased in size significantly. Satisfied with the final outcome of the septum resection, I then introduce a number 8 Foley's catheter and inflate it with 3 ml of distilled water. This catheter is then kept for the next 7 days to avoid adhesion and act as an adhesion barrier. Thank you for watching.